Dr. Janester Wilson King, all the way from Florida. So,
Yes,
Janester,
hello.
yeah, so tell us about yourself.
Okay, I am, as is Dr. Apgar, a board certified OBGYN, been in practice for a number of years. But for my past 10 years, my practice has transitioned to more of a wellness practice, an integrative wellness practice, such that I assess where people are on the health and wellness spectrum and help them get to where they'd like to be. And I take care of men and women. I do nutritional suggestions for and lifestyle modification. We talk about supplements. And how you can get everything from food, but sometimes you do need supplements. So we assess those, and we use hormones, bioidentical hormones, and cannabis.
I love it because, food is medicine, right?
Absolutely,
Yes,
absolutely. We
yes,
want to eat good foods so we can get the nourishment we need,
yes,
as
and
opposed to taking a bunch of pills.
yes. And if your medical education was anything like mine, there wasn't a lot of attention spent on nutrition, very sadly.
No, I think we had 4 weeks,
Oh,
maybe.
maybe. Yeah, and biochemistry, right? Yeah.
Yeah, exactly,
Okay,
exactly.
good. All right. Well, how did you get affiliated with the Stanford Sexual Health Study?
Okay, in 2018, I was approached by Dr. Michael Eisenberg, who's head of the Department of Urology at Stanford Medical School. And he had already published two studies. The first was a survey via the National Survey of Family Growth on the association between cannabis use and sexual frequency. And the results showed that male and female monthly, weekly, and daily cannabis users had significantly higher sexual frequency compared with never users. He did a second study using that same group of people to look, entitled Association Between Use of Cannabis and Time to Pregnancy in Men and Women. And the study demonstrated that there was no statistically significant impact of cannabis use on the time to conceive a baby. You know how oftentimes cannabis use is put down as one of the factors that increase your risk of infertility.
Right,
And per this survey, that didn't hold to be true.
right.
So when he approached me, we decided the next step would be to delve into more specific information about the types of cannabis chemovars used, the frequency of use, the reason for use, and the route of administration, and to incorporate a known and widely used tool to screen for sexual dysfunction in men and women. The survey takes maybe around 10 minutes to complete, and it's got IRB approval, and it's HIPAA compliant and totally anonymous.
Yeah, and it's really easy. I actually did it on my cell phone. It just, like you said, it took no more than, it was honestly like 7 minutes for me. But yeah,
Right.
that's great. So obviously, me being here on the front lines and, being in this dispensary and dealing with patients on an individual basis and in real time. And then obviously, the two of us having a lifetime of talking about sex with our patients in the intimate office setting. Um, there's really no two greater individuals to talk to about sex and cannabis, as it turns out.
That's for sure.
Yes,
That's for
that's for
sure.
sure. So we certainly have a lot of robust anecdotal experience and certainly lots and lots of patients who have been coming and telling us how much cannabis is improving their sex life. And it's not just the frequency of sex, but it is the actual quality of sex.
Absolutely.
Do you have anything
Absolutely.
to add to that? Do you have any insights?
Well, certainly, sex, cannabis and sex, there's a lot of interest in cannabis and sex, cannabis and sexual health, cannabis and sexual dysfunction. Because, to be honest with you, we don't really have much in the way of medications and things to use to help women.
No.
They've spent a lot of time in the pharmaceutical industry trying to help men with erectile dysfunction, but there really isn't anything out here to help women.
Right.
Now, you and I know that hormone treatment is very helpful, but it's not the panacea.
No.
that people want to believe it is.
Right.
It just isn't.
Right.
So, and various things can interfere with a woman's ability to have sex.
We're very complicated, aren't we?
And I'm telling you, we are very complicated and we are very sensitive because sex and sexual enjoyment, sexual desire, sexual awareness is really a major head game with women.
Right.
The least little thing can throw you off and you're like, I'm not interested.
Right.
So yeah, we definitely see that quite a bit. And the other thing I wanted to make sure we touch on is the fact that cannabis affects men and women differently.
Right.
And there's been a couple of studies, one by Carrie Cutler et al. In 2016, and et cetera. But let's just talk about some of those differences. The studies indicated that men reported using cannabis more frequently. Men are actually up to 4 times more likely to try cannabis, and they use cannabis in higher quantities. They tend to use more joints, blunts, vaporizers, and concentrates. They also report increased appetite, improved memory, enthusiasm. And then when men are withdrawing from cannabis, they have just some insomnia and vivid dreams. But women, on the other hand, report using cannabis less frequency and in lower quantities. But women use cannabis for a reason rather than just using cannabis.
Exactly.
Women use pipes and use oral administration more often. And we get a loss of appetite. And the other thing, and you'll find this, I'm sure you're aware of this, we feel a desire to clean when we're hot.
Oh, yeah. Yeah, give us some limonene. Yeah, give us some limonene. We'll clean the kitchen for you. Toot sweet. Yeah, exactly.
Exactly.
Yeah.
And women actually have more severe withdrawal symptoms, such as nausea and anxiety. And women show a more rapid progression from first use to cannabis use disorder.
Exactly.
So we are definitely different when it comes to responses to cannabis. And the reason for that is that estradiol. What's the difference between men and women? Primarily estradiol.
Yeah.
And that's the hormone that impacts makes the sexual dimorphic differences with the cannabinoids. And estradiol actually regulates the female response to cannabinoids.
It sure does. Yeah, and
blood levels of enzymes, that break down. That break down the cannabinoids fluctuate across the human menstrual cycle.
Yes, it's fascinating.
So you may find You may find differences in your responses to cannabis depending on where you are in the menstrual cycle.
Exactly.
And then with aging, studies have shown that brain levels of the cannabinoid receptors increase with aging. So then you have a difference in cannabis use during menopause.
Exactly. So what I find very interesting is, what is PMS really? Is PMS a low level of anandamide because of the falling level of estradiol right before the cycle? I mean, it's very interesting, all of this interplay. We could theorize. You and I need to go out for a cocktail and talk about all of our theories here. But what we really need is for science to catch up, and we need some really good studies to really help document what's going on and help pave the way for the future. So we are grateful that this study is here, that all of our patients have access to. We're actually sticking, it's just a little itty bitty like a business card actually, and it has a little QR code on it that you can scan with your phone. And so we're putting that in everybody's bag when they leave and talking to them about it. And we really hope that all of our patients will participate, because we want to collect as much data as we can. So,
thank you, Dr. Akbar. That is so wonderful, because we want as much participation as possible.
Yes, absolutely. So that's fantastic. So how are you related to the cannabis world down there in Florida? It's a medical state, but is it recreational yet or not?
No, it's medical. We thought we were going to get adult use put on the ballot this year, but it didn't make it. So we're going to be medical use probably for a few more years. Yes, we are medical, and we have we're medical and it's good, but we have a finite list of qualifying conditions uh, that you can use to be a patient, and it's pretty limited.
Mhm.
There are some ways around it, but you have to be careful.
Yeah, and I guess low libido is probably not one of the qualifying conditions, huh?
Of course not. If it
Yeah.
was something related to a man, it probably would have made it on there.
Yeah. So exactly. If it was a little blue pill, it would be on there already. So
Exactly.
I can tell some of the listeners what our patients are saying about some of the cannabis products. And funny enough, Gina and I have a line of cannabis products specifically formulated for women, and one of the lines is not even out yet. It's called Smolder, which is what everybody would love to have right now.
Ooh.
But I mean, right? The name itself kind of makes you want to try it.
Very intriguing.
Right,
yes.
right. So what we have found, though, even with the balance pen, which is a 1-to-1 ratio of CBD to THC, is that patients are really reporting better sex. And that pen was designed to treat anxiety. We wanted it to be a real balanced effect, that patients weren't feeling impaired. But anxiety and getting out of our heads is part of what is a barrier to a lot of women to initiate sexual contact or to initiate, a really good sexual experience. And so that's why we're finding that patients are really benefiting from even just the balance pen out of the gate. We're getting a lot of very interesting feedback from the patients. So that's part of it, is that if we can get patients to disengage and get rid of their anxiety and just kind of relax, their inhibitions are a little bit reduced and things start to feel good. And females are funny. I mean, we decide to have sex. We don't necessarily want to. Wasn't really on our agenda today.
Exactly, it's not on our to-do list.
It's not. And unlike men,
we sometimes even look at it like, oh no, another thing that I have
exactly.
to worry about
It's
doing.
another to-do, right?
Exactly.
So women are funny. So if cannabis can help women get there and make them more ready to make that decision, then the whole circular sexual response cycle is able to start. And then the other thing cannabis is doing, and this is part of what is so exciting and so interesting when we start dissecting all these receptors and all these different major and minor cannabinoids and all the terpenes and how everything is working together. But what is happening to excite those nerve endings? Why do people report so much more of a satisfaction level from their sexual encounters? I mean, people are coming in and they're like, my God, we feel like we're newlyweds again, the couples that come in and talk to me about it. So it's really interesting what cannabis is doing on a cellular level.
It really, really is. And there's so much to this plant that we just don't understand yet. We're only scraping the tip, the very tip of the iceberg, as far as our knowledge about all the things this plant can do, all the things that are even in the plant, and all the effects of the plant on the human body. And there's lots of preclinical studies, but that isn't human. That doesn't always translate to humans.
Yeah.
So we've got a lot of ways to go. But I'll tell you, adding cannabis to the toolbox in managing women and hormones has really been a major impact. And like you were saying, women and adding that cannabis really does enhance their sexual life. I've got a lot of menopausal women who are nicely hormonally balanced. Mm-hmm. They're not having the weight gain anymore. They're sleeping well, etc. But they still just weren't able to get over the hump with that desire for sex and that desire for quality sex and participation. And using cannabis has helped them tremendously.
Yeah, and I love that you say that, because cannabis is not the one-stop shop that so many of my patients come in here and they expect that cannabis is going to solve everything. And it's one piece of the puzzle. And I
Yes.
cannot stress that enough. I mean, we always talk to our patients about a balanced, healthy diet. And
Yes.
I know I'm from the West Coast and
Yes.
I'm a little new agey, but I do really advocate a plant based diet. I think there's a lot of benefit to that. I think we eat way too much animal protein. I don't necessarily think that everybody should be a vegetarian, but I really feel that if you can get nutrition through your food and get the important things that we need out of our food,
That's
you're
right.
really ahead of the game. Our guts are very broken. That's where anxiety starts. That's where inflammation starts. That's just the opportunity for disease to manifest. So just doing cannabis in and of itself is not going to, treat the whole thing. And then you and I, as gynecologists, have all of that understanding about hormonal balance and how important that is as we get older through all the stages of our lives, actually. So it really is just
Yes.
one piece to the puzzle, but we found it to be a very important piece.
Very much so. An extremely important piece. As important as you were saying, nutrition, as exercise. Exercise can help you sleep well too.
Yeah.
And a lot of people don't they say, oh yeah, physicians say eat well and exercise, but yeah, okay, I just want to be able to eat whatever I want, just fix me so I can do whatever I want, and it doesn't always work that way.
Yeah, it's
You
so
really
true.
have to put all the other pieces together to really optimize your response to cannabis
Yep.
and your whole quality
I
of life.
love I
That's for
love the way
sure.
you phrase it. It's so true. So we have a couple of questions. We have
Okay.
from one of our patients. Have you been seeing results in your practice for cannabis with endometriosis? And Sophie, it's interesting. I actually wrote an article about cannabis and endometriosis, which is kind of crazy. I haven't actually had to write a real article since I think medical school. It was very challenging and very hard. And I really admire those individuals who can sit there and dedicate that much time to the research part of it. But in any case, it turns out that cannabis is a perfect choice for something like endometriosis, which is a chronic inflammatory condition. And funny enough, endometriosis acts a lot like cancer and uses some of the same proteins to kind of propagate throughout the body. But those of you suffering from endometriosis, and Dr. Wilson King knows this obviously all too well, some of the most debilitating pain out there, and a very frustrating condition for gynecologists to treat because really some of the only other options out there are fairly disruptive to your life hormonally, and there aren't great treatment options for endometriosis. So that said, cannabis is wonderful as an anti-inflammatory. That's what it is mostly, is an anti-inflammatory. And so for anyone with an inflammatory condition and chronic pain, we've had great success using cannabis. So the answer to that is a resounding yes. Do you have anything to add to that?
Yes, I do. Of course, everything you said was so correct. There was an animal study, a mouse model that showed where THC actually improved the symptoms associated with endometriosis in the mouse model. But what I want to mainly tell you is that THC and its can reduce chronic pelvic pain and actually shrink uterine growths.
Yeah.
In that same mouse study of endometriosis, they have a picture of, they created endometriosis in the mice and then gave them injections of THC and showed over time, I think it was about 4 weeks time, that the endometriosis decreased. So there's some preclinical data that cannabis can actually improve and treat endometriosis. It's still early, but my patient, clinically and experientially, patients are finding improvement with the use of cannabis.
Right.
Whereas all the other things we used to do, laparoscopic cautery and the ovarian suppression, and
it's
things
horrible.
like that, are just all so
it's
invasive,
so disruptive. Right.
Yes. It really, really is. And it's hard to make a patient live under those circumstances and expect them to have quality life.
Exactly.
So if we can really see how cannabis use can really impact them, boy, we've got a major hurdle
Yep.
conquered there.
Okay, we have another question. Moving right along. What products would you suggest starting out with if you wanted to mix cannabis and sex? And that's a great question. And it really depends on who's asking it and what their
Yes.
experience with cannabis is, because that really
Yes.
dictates kind of where we start. Obviously, in medicine, we're taught you start low, you go slow. Cannabis is no different. And as we all know, THC is a very potent molecule and you don't need very much of it to get the job done. So, for immediate gratification, we're going to recommend vaping or smoking because that's going to get into our bloodstream almost immediately. There are some
Yes.
really cool things that are
Mm-hmm.
coming, which I'm not at liberty to say, but there's some new delivery systems which would be instantaneous as well that do not involve smoking or vaping. And then we also have edibles where you take something by mouth, but the effects are variable, really variable. They depend on if you have a full stomach. They depend on how much you took, whether you ate a fatty meal with it or you have, fat soluble anything in your system when you take that. And so that's going to take a little bit longer, but it's going to be a different effect when you feel it. And then what I would love to see and what we're developing right now is a vaginal application where it goes right into the bloodstream, bypasses the liver, which Dr. Wilson King well knows as far as us being
Mm-hmm.
gynecologists. It's a very familiar route of administration for us. And then for those menopausal women who maybe don't want to be on hormones or are not able to be on hormones and are not able to have the same amount of lubrication as they normally would when they were younger, we would love to have a lubricant involved in that as far as sex. So that's going to give you immediate gratification as far as um, having the feeling in your bloodstream as well
Mm-hmm.
as topically having it also feel good.
Right. Right. Absolutely. And one thing I would add is when we talk about vaping, I really like the old fashioned or the vaporizer route of administration as opposed to vape pens, just because you're using flour,
I
so
love
you're
you.
getting the most
Mm-hmm.
of the terpenes and
Yeah,
whatnot,
I love that
and
you say that.
really,
Oh, yeah.
and really can get a full effect, and it's really lovely.
Yeah, I guess
It
we should have
really,
been naturopaths, you and I. We
yes.
didn't do it right. Yeah, it's funny. Gina and I really came into this industry thinking that flower and smoking was very tawdry and very dirty, and I really have had such an education, hands on, and doing such a deep dive into the research of this. But dang, Mother Nature does a better job than we do,
Oh,
and I love it. It's
absolutely.
steaming or vaping that actual flower
Mm-hmm.
is truly the best way of getting that robust mix of all that that flower has. That
Yes.
said, for novice users, that can be a little intimidating, but I get what you're saying, and you are speaking my language for sure. That's great.
Right.
All
Just
right.
wanted to
Well,
let people know there's another option. That's all. But you're right on, spot
exactly.
on with all of your examples.
Well, I love what you're doing. I love your holistic approach to helping women. I think it's absolutely fantastic. We echo it here in all that we do and trying to help people create their best lives. And I look forward to continued collaboration with you. I know we'll be speaking again soon. So we really
Yes,
appreciate you
please.
joining us today on this fabulous
Oh, and I
Monday.
thank you so much for the invitation, and it was my pleasure to talk with you. And I really do look forward to many more
I love
conversations
it. I
and
love it.
visiting your dispensary.
Please come up anytime. Can't wait.
Okay.
All right.
All
Have a
righty.
great Monday. And we'll see
You
you
do the
guys next
same.
week. Bye bye.
All right.